Good afternoon. I'm Dennis Galucki. Welcome to the 543rd Imagine Greater Buffalo program and our 165th YouTube Imagine Buffalo, hosted by our wonderful Buffalo and Erie County Public Library. Thank you for joining us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, or C-SAAHN, as I like to pronounce the acronym, and ImagineLifelongLearning.com. Now, before we get started, just a little housekeeping. Everyone watching will be muted and your video turned off. If you do have a question or comment, please type it into the chat box and we'll go through them at the end of the presentation. We are recording this program so you can watch it again later on the Downtown Central Library's Facebook page and YouTube channels, and we certainly hope you share the link with others. Now, on to our featured speaker. Michael Ball is Vice President of Community Affairs for Highmark Blue Cross Blue Shield, where he oversees the company's support of corporate grants, sponsorships, and community programs, services, and initiatives aimed at addressing health disparities throughout the community. He also leads all elements of the Health Plans Blue Fund, which awards major grants to local organizations and initiatives that enhance the health of the region. Mike Ball is a native of Buffalo, New York. He serves on the board of directors for Buffalo Urban League, the board of trustees for Buffalo Olmsted Parks Conservancy, the board of directors for Buffalo Sabres Foundation, and the alumni board of governors for Canisius High School. His presentation today focuses on building community trust to advance health equity. And I might mention he's part of a panel that will be part of Buffalo Day at Chautauqua. That's July 23rd, coming up, a Tuesday. And and the theme for that day is Buffalo and Chautauqua, advancing racial equity. Mike, take it away.
Thanks, Dennis. I'm going to pull up the presentation and to get us started here. Great.
Looks good.
All right. Great. Well, let's see here. Well, Dennis, first, thanks for the incredible opportunity to be a part of this Imagine program and for your commitment and all that you do for Buffalo. And also want to thank the Buffalo and Erie County Libraries for what you're doing collectively to bring the community together for learning and thoughtful dialogue. So I've been somebody who's been in the audience on these for these presentations, and I've learned from a lot of other speakers. So it's really an honor to be presenting to everybody today. Just a little bit about my background, and Dennis, thanks for the great bio. Like you said, I'm a lifelong resident of Western New York, born and raised in the city of Buffalo, where I still reside today. I've lived here all my life, and I really love this community. My background might not be what you'd expect coming from someone that works for a health plan. Prior to joining the team at Highmark in 2018, I worked as an urban planner and economic development professional in the private sector, the nonprofit sector, and the government sectors, which I believe affords me the opportunity to really bring a depth of perspective, experience, but also a commitment to collaboration and partnership to my current role overseeing community affairs for Highmark Blue Cross Blue Shield. For me, it's always been about the community. I love my job, my team, and working for Highmark. So speaking of Highmark, the name, while it might be relatively new to many of us still, the company has been here for over 86 years. So many of you, before we were Highmark, you might have known us as Blue Cross Blue Shield of Western New York. We affiliated with Highmark in March of 2021 and became Highmark Blue Cross Blue Shield We still serve over 500,000 members across the 8 counties of Western New York. So for us, the geography of Western New York is the 8 counties. So once you get to Rochester, that's out of our territory, but we go up almost as close as Rochester. Um, Being a blue gives us really 107 million covered members nationwide. So that's really one of the biggest benefits of being blue, is that 1 in 3 Americans carry the blue card. We still have a significant workforce. We really consider ourselves one of the major corporate citizens in downtown Buffalo. We have over 1,400 local employees, really more than any other health plan here in our community. We're really proud of our long legacy of a unionized workforce that supports our teams and our community every day. And we're also very proud of the investments that we make, and I'll talk a little bit more about that, which exceeds over $8 million annually in community investment. So that's supporting nonprofit organizations that are really helping us keep our community healthy and move the needle on some of the health disparities. And obviously, being blue, we have a really large physician network. We couldn't do what we do without our provider partners, our hospital partners, our community-based organization partners, and we're really proud of that. So when we talk about equity, there are just some common terms that I thought we could establish as a baseline for the conversation. These terms help us have the conversation at a variety of different levels, whether we're talking about everyone in the community broadly, whether we're talking about a specific community, or if we're talking about individuals. For instance, population health is the health status and health outcomes within a group of people, rather than considering the health of one person at a time. And therefore, that requires a comprehensive, very multi-sectoral approach. Then we've got the social determinants of health, or SDOH, which is a very common term and common concept that is used and applied today, which refers to the environmental, non-medical conditions where people are born, where we grow up, where we work, and where we play, and how that affects our individual health outcomes. We know that 80% of what makes up someone's health is determined by what actually happens outside of the hospital and the health clinic. A few examples of the social determinants would include employment, food security and your access to healthy food, housing stability, access to early childhood education, and transportation. And we've got health-related social need, or HRSN, which is an individual's unmet adverse social conditions that contribute to poor health and are a result of the underlying social determinants of health. And then health equity and racial equity, which is what we're here to talk about today, is the state in which every individual has a fair and just opportunity to either achieve their health potential or to improve their overall outcomes. And Dennis, I did take a little liberty, you might have saw in my title slide. I did sneak health into the title. I know we're talking about racial equity, but as a health plan, we really believe that health is a very, very important part of the equity discussion. So we really turn to the CDC for our benchmark and a common definition of health and racial equity. So according to the CDC, health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And achieving this requires ongoing societal efforts, which you can see in the diagram here. It's addressing historical and contemporary injustices, overcoming economic, social, and other obstacles to health and healthcare, and eliminating preventable health disparities. And to achieve health equity, we have to change the systems and the policies that have resulted in generational injustices that give rise to racial and ethnic health disparities. And I know your guest speakers in the last Imagine conversation talked about that extensively. So this is a nice tie-in, and we look forward to talking about this more at Chautauqua too. Significant health disparities, which are quantifiable differences in health-related outcomes, have been documented across many dimensions, including race, gender, age, location, disability status, and sexual orientation. And these disparities contribute to life expectancy, birth outcomes, chronic disease status, morbidity, and more, and are evidence of systematic structural inequities that affect us as individuals and also affect community health and well-being. So what's driving these inequities and outcomes? Healthcare itself is only one factor that affects a person's health. As I mentioned, the social determinants or the drivers of health can account for 80% of health outcomes, whether that's positive or negative. And there's three main categories that drive health. It's our environmental factors, which is a physical environment, including food and infrastructure. We've got economic factors, which include the economy, wealth, and employment. And then social factors, which include safety, connection, and education. And then discrimination and biases, including racism, often layer and fuel negative health outcomes. But they're all interconnected, which is what this diagram is really trying to tell us. And that's why it's important for organizations to focus on addressing the root causes that drive inequities in our community. And as a health plan, addressing social determinants of health is really central to how we operate. So what's a health plan's role? Payers, employers, providers, individuals, we all have a role in addressing inequities. Health plans in particular are uniquely positioned to address health inequities as we have relationships with many stakeholders in our community and interact with aspects of the entire healthcare delivery system. As a health plan, this is how we view our role in addressing health inequities. We look at trying to address the root causes. We support community-based organizations and work with them on partnerships and solutions, which I'll talk more about. We're really promoting and engaged in education and preventative care and care coordination. Those things that we can do to help keep us out of the healthcare system if need be, as much as we can before we have to take the time away from our daily lives in the hospital, in the healthcare system, and then the expenses that go along with that. And then data advancement, making sure that we're learning as much as we can from the information that we're collecting and then applying that to improvements and innovation in healthcare. So I talk a lot about partnerships and everything that we do. It's especially important as we look at advancing health equity. So who exactly is a stakeholder when it comes to improving health equity? If you have a vested interest in working to ensure everyone has access to high quality care, regardless of race and ethnicity, economic status, zip code, or other demographic factors, then you have a stake in creating positive change. Hospitals and health systems, community-based social service providers, business leaders, our faith-based organizations, and community members, among others, are examples of stakeholders who can strengthen collective initiatives to advance health equity through coordinated efforts that can help build trust and ultimately make an impact. So we collaborate and coordinate with experts, partners, organizations, and volunteers to help millions of people live healthier and happier lives. We're working to improve equitable access to high quality care, quality of life, and economic resilience. And we're striving to address economic instability, connect social and community resources, support access to education, improve neighborhoods, and most importantly, overall, improve health outcomes. So as I mentioned, as a company, we've been in this community for a really long time, for over 86 years. And while we've been one of New York's most community-minded and financially committed organizations, our affiliation with Highmark Health really has allowed us to strengthen our community investments greatly. Over the past 5 years, we've invested more than $35 million in partnerships and initiatives that I was describing on the other slides that enhance the health of our community. And just last year, our support of these stakeholders exceeded $8 million. So I'm pleased to share some specific partnerships that are addressing the health equity factors that I highlighted on that wheel back on slide 4. In the area of our physical environment, we're investing in parks and green spaces because they contribute significantly to the health and well-being of individuals and their communities. These health benefits are magnified when parks are equitable, meaning that all community members, regardless of your race, income, age, or other characteristic, have access to this space to be safe and physically active. Food and poor nutrition is another leading cause of illness, healthcare spending, and also lost productivity in the US and globally, predominantly from cardiometabolic diseases, cancers, other chronic conditions, and undernutrition. These burdens disproportionately harm lower income, less educated, and minority racial and ethnic groups contributing to health disparities. As I'm sure this is going to come as no news for your audience and for the individuals that are on this presentation and session today, nourishing foods are foundational to achieving health and well-being for all people, which is why we're investing over $3.5 million to address food insecurity in our community through programs like mobile markets, which are meeting people where they are with healthy, nutritious food, education, and programming. Eating healthy, getting regular medical checkups, exercising, and sleeping sufficiently are all behaviors well known to influence health quality. However, studies suggest one unexpected factor that can predict how long people live, and that's education. Education gives people the tools that they need to lead fulfilling lives, thrive personally, and contribute to their communities. And in addition, education makes it more likely a person can access quality health care, that they can find employment that pays a living wage, and live in a safe, non-polluted environment, all factors that affect well-being, which is why we're also working closely with Say Yes and other programs to ensure education, access, and success for all. And then on the connection piece of this slide, we've got our Blue Neighbors program here at Highmark, where our employees are really leading by example and connecting with our community by joining community boards and volunteering. We're really fortunate that we have a culture that gives back, and we have employees that really, since the pandemic, are excited to be out in the community, working alongside their neighbors and their peers, really helping to make a difference in our community. And then you've got workforce development, which is related to education, but goes even deeper to make sure that everyone can be trained in life-sustaining careers to meet individual needs and help fuel our local economy. And so just some of the partnerships that we've engaged with to help move the needle on workforce is 43 North, and all they're doing to not only bring companies to Buffalo and Western New York through the business plan competition, but all the work that they're doing to help cultivate an entrepreneurial ecosystem, and one that's also diverse and open and accessible to everyone. And we work closely with the Northland Training Workforce Center in East Buffalo around manufacturing opportunities and providing all the social soft skills that the workforce needs today. So this slide highlights Blue Fund. So Dennis mentioned Blue Fund. It's our health-focused grant program. It's one of the critical tools that we have to support organizations in our community. It's important to note that while Blue Fund provides some of the largest support to organizations, we also do a number of relationships and support through sponsorships and other partnerships. But Blue Fund is our health-focused grant program. It's not a foundation. These are corporate dollars. But the way that it's structured is that it really walks and talks like a foundation. And we turned to a number of our foundation partners in Western New York that really helped us create something that we feel like follows their best practice. It continues to demonstrate our ongoing commitment. But what we also see is ongoing needs. So here on the slide, you're really getting the first preview of the current grant cycle that we're in right now, but it gives you a good snapshot of the volume that comes through Blue Fund. This year, through our letter of intent pre-application phase, we received over 160 letters of intent. That's a 50% increase year over year. So what that tells us is that the needs continue to persist. The needs are greater than ever. Unfortunately, we can't support all of those. There's $30 million worth of asks And each year we end up awarding $3 to $6 million in Blue Fund, which is extremely significant. But as you can see, there's just so much need. So what we try to do is work with our network of other funders, and leverage those relationships in a way that hopefully can provide support to those that were unable to fund through Blue Fund. So that's it for my formal presentation. Again, it's really an honor and a pleasure to be here. Look forward to any conversation today or future conversations. I guess I'll turn it back over to you, Dennis.
Mike, that was a wonderful overview. Your challenge on the 23rd of July is there's no ability in the Hall of Philosophy to show things. You can bring some packets if you want diagrams or something to be handouts for the audience. You can do that, but it's a comprehensive story. I'm going to just on a personal basis. You've lived in Buffalo all your life. Just going back, we just had the anniversary of May 14th, tragic day suddenly in Buffalo's history, obviously. And it just struck me how somebody, we've known all along these variations, these inequities that exist based on zip codes. If you're in 14208, life is different than if you're in 14209 and other zip codes. So that one of the things that we're doing with this Buffalo Day is to say, listen, the only way we can address inequities and zip codes is to make everybody free. and then you're all suddenly for that day at Chautauqua equal. Everybody from Buffalo and 44 zip codes can get to Chautauqua on Buffalo Day, July 23rd, and they're admitted free. All right, with that, I'm just wondering how you personally were affected by May 14th. Oh, you're in a incredible organization at Highmark. It just has it weaves throughout the community, from football stadiums to the smallest groups that are impacted by your sponsorships and your grant making and the program you've just presented. How was there any different thought that emerged after May 14th, 2 years ago, affecting you and Highmark? Any thoughts, any comment?
Yeah, Dennis, thanks for that question. Like anyone who lives in Buffalo, I don't think anybody walked away from that event unaffected. As a lifelong Buffalonian, it was extremely hard to see the community go through that. And from a corporate standpoint too, unfortunately, we lost one of our employees. Catherine Massey was in the top supermarket, and unfortunately was one of the victims that day. So it really hit us personally as a company. How we responded in part to that relationship and that impact to us is that we did establish a scholarship in Kat's name. She was affectionately known as Kat Massey. So working with the Community Foundation for Greater Buffalo, we did establish a scholarship fund because she was so dedicated to the Buffalo Public Schools and young people in our community. How we responded more broadly in the community, I think, Dennis, you're right. Like what that brought to light in particular was the lack of healthy food access on the east side. When Tops was no longer open, it brought what many knew as a disparity. It really brought it to the surface and actually brought to light just how significant the need was. So we're working along a number of community partners to help address food access in East Buffalo. And then I would say, another area that in particular, I think a lot came to light on 514, but also the need for mental health services, in particular, mental health services for the community, with and for the community. So not long after the tragic massacre occurred, we did work with a number of organizations in the community, Buffalo Urban League, Spectrum, Best Self, really all the mental health providers, to make sure that the response was adequate and was there for the community. And then we're constantly working to make sure that uh, that those professionals look like they're part of the community when we talked about trust. So um, a lot has come out of that. I would say the way Buffalo always does, as the city of good neighbors, people have come together in response to that, which continues to be ongoing. And again, as a longtime corporate citizen in the city of Buffalo, Highmark just continues to be committed to moving that work forward and addressing the needs, especially in East Buffalo.
Good. Joy, how are we doing for some questions? Thanks, Mike. That was a good overview. Thank you.
So I do want to add that Highmark Blue Cross, and we talked about this before we started, really helped out the libraries. Our 37 libraries have CPR kits, compliments of Highmark Blue Cross and the Buffalo Bills Foundation. And that was really in the wake of Buffalo Bills football player Damar Hamlin having his heart incident. And what happened quickly after that was our partners from Blue Cross and the Heart Association and the Bills Foundation gathered together and said, how can we get some CPR kits into the community? And so now you can actually borrow a child's or an adult CPR kit and learn how to do it, learn how to do the hands-on. Hopefully you will never need to use it, but you can learn from the library thanks to your sponsorship. We do have a question. Someone's asking, can you provide info on Highmark's work on increasing equal access to physicians? I think you are muted, Michael. Yeah.
Okay. So the question was, what is Highmark doing to improve access?
Yeah, I'll just repeat it. Can you provide information on Highmark's work on increasing equal access to physicians? I don't know, the person that sent it, do you want to add anything to that? Clarify it all?
It's a broad question. Hard to.
Yeah, it's pretty broad. I mean, it could even mean transportation. It could mean financial.
So as a health plan, thankfully we have an extensive network of providers, and really we're fortunate to have a deep bench of professionals that are addressing the social determinants of health. So Joy, to your point, we've got we actually have it's called Find Help. So we have a platform that is available to anyone in the community where they can seek out those any of those services that they need to help them get to providers if the care that they need is not easily accessible. So whether it is transportation, if you've got childcare challenges, or if you just need help identifying a physician, that information is available on our website. I will say that we're also working with a number of organizations to help bring care where people are. So we've done that through medical units, other dental units, and we're especially focused on rural health as well. So working with rural healthcare providers to sort of make mobile units available so that they can help meet people where they are. I know that that's a kind of a quick answer. It's a really important question, and one that I'd be happy to take offline with anybody who wants to discuss it more.
Oh, Joy.
Sorry, I didn't. Yeah. I was muted there. The writer did write back, are there less co-pays toward the financial cost? So is Highmark doing anything in terms of maybe it's reducing one's co-pay? And maybe that's the kind of thing that through your website, someone can assist someone with that answer if there's a specific.
Yeah, I'd love to help connect that person with sort of the team here that can work through that item more specifically. It's a great question. It's a really important one. There's a lot of different ways to answer that. So I'd be happy to help connect that individual with the folks that can help them get the answers that they need.
Mike, is there a information phone number or a website that you want us to push out?
Yeah, if you go to Highmark Blue Cross Blue Shield, would be a great place to start. And but again, I don't want to just send someone to a website. If there's something that I can do to help direct that individual, but the website is a great place to start. If you're already a Highmark member, we have an incredible application portal. It's called the My Highmark app, and which makes navigating the healthcare system a little bit easier and a little more friendly. So that's another opportunity for resources and information.
Okay. I'll say the other thing, the person who is writing these questions, if you want to write back to me with your email address, I'll hand it over to Mike right after the program.
Great.
Okay.
Thank you.
All right. And then we just have one more thing. You mentioned you have about 14,000 workers locally. Was that right?
1,400.
1,400, which is still a substantial number. Are you still hiring, and what are you hiring for?
Yeah, great question. The answer is yes. Again, I would direct anybody interested in pursuing an opportunity at Highmark to our website. There's all sorts of opportunities there. So as you can imagine, there's a lot of different positions, lots of different jobs. So I would go to the Highmark, and again, start at the Highmark Blue Cross Blue Shield website and navigate to careers.
Okay. That's all I got, Dennis.
Good, thanks. Mike, one overview question, if I could, just to wrap it up. I had Scott Scanlon on from the Buffalo News Refresh. Every year we go over the Robert Wood Johnson county rankings throughout all the states. And it just, it always is amazing to me how, unfortunately, Western New York seems to rank low within New York State. Forget the rest of the country, but and here we are with a medical school and a Buffalo Niagara medical campus and a Blue Cross Blue Shield downtown, and you just say the county seems to make a priority of these issues. You've given a great speech, presentation. M&T, Glenn Jackson said all the good things a headquartered company are doing. Very simply, why do you think that persists that way? Is it the way they measure things and it's skewed against Buffalo, or what? Why do we look bad on a national report like that year in and year out? Why do you think?
Yeah, Dennis, that's probably a topic in and of itself, right?
It is.
Yeah. I think there's probably a number of ways to answer that. It is always unfortunate to see those reports come out and to see our community near the top. There's a number of reasons for that. I think some of it can be attributed to just our, we're one of the poorest communities in the country. And some reports will say we're still one of the most divided communities, I think, when you talk about us racially and otherwise. So I think those are contributing factors. The good news is that I've been working in this community my entire career. There's more collaboration happening than ever. And I think there's more awareness and acknowledgement that we need to do better, and that we need to focus on those that have been disadvantaged, where there are the highest rates of disparities, whether it's racial and or health, that there's a lot of efforts and a lot of collaboration to address those specifically. So I think that, the future is bright as far as that goes. And some of those stakeholders that you just mentioned maybe weren't collaborating to the level that they needed to in the past, but it is happening now. which is promising. So I don't know if that answers your question specifically, but the good news is, there's a great acknowledgement for it and strategies to try to address it. And I think that's very positive.
And that's the good news I wanted to leave this program on, Mike. There are good things that this is about the theme one of the two themes I use is to imagine a healthy, wealthy, and sustainable community. And to the degree that the library is the center point of lifelong learning, that's where that's what has to happen. And a program like this, I hope it does its small piece of helping to make that happen, the awareness. So I wanted to raise the question, allow you to give that optimistic answer that people are concerned about it, are working the best they can, and improvement should be at hand. And that's about the best we can do to leave this thought on and continue with it in Chautauqua on Buffalo Day at Chautauqua on the 23rd of July. So again, folks, if there's 44 zip codes between 14201 and 14280, if you live in those, you have free access to Chautauqua. That's no small matter. If you've gone to Chautauqua, you know for a family anyways, it can cost quite a bit. It's free that day if you live here. So take advantage of it and experience Chautauqua on July 23rd. Mike, thank you very much for a great presentation. And folks, thank you. As we wrap up for our summer break coming up here, next week is our last program before that. And we will have the Senior Vice President and Chief Inclusion, Diversity, Equity, and Accessibility Officer, newly hired at Chautauqua Institution, Amit Taneja. And he will be part of the panel that you will be on, Mike Ball, so along with Glenn Campbell and Felicia Beard, the head of the Racial Equity Roundtable for the Community Foundation. Other people from Buffalo will be presenters during the day, so we hope you can join us then. In the meantime, come back next week and certainly hold that July 23rd date, Buffalo Day at Chautauqua. I'm Dennis Galucki. Be well and good day.